Hello everyone, I'm Dr. Arti Bellary. I'm a senior consultant physician, internal medicine specialist from Amore Hospitals. So this is the time of the year when we hear about a lot of seasonal flus, about respiratory infections and other sorts of fevers. Now in the next few minutes, I'll be covering some important issues that we face. That is, if you get a fever, when should you approach the doctor? What test should be done? Should the test be done or not? When does it become serious? These are the questions which completely arise in our minds. So during this season, that is in winter, what we normally see is the respiratory infections. That is in terms of upper respiratory tract infections or lower respiratory tract infections. Upper respiratory tract infections are when it affects your nose, mouth and throat, causing dry cough, runny nose, stuffy nose. All these are upper respiratory tract infections. And lower respiratory tract infection is when the patient has a lot of fever, high-grade fevers with cough, with lot of sputum and some sort of breathing difficulty. So usually upper respiratory tract infections and the causes for these two will be viral infections. Most commonly what we do see is viral infections causes this, like seasonal influenza virus and respiratory viruses can cause these infections. And lower respiratory tract infections could start off as viral but eventually may cause even bacterial growth and can be bacterial infections also. So in respiratory infections, how long can you wait? If it is a regular cold, cough and runny nose, a little bit of headache, sinusitis, and those can be treated just with symptomatic therapy if you are considering only viral infections. That is giving you antipyretics to bring down the fever, antihistamines which will bring down the allergy part. And also we give additionally a lot of fluids to be taken in any sort of infection. And if it is persisting beyond day 5, day 4 to day 5, if the fever is not coming down, or if you're developing breathing difficulty or you're becoming very weak, in that case you should definitely see the doctor and they will order the appropriate tests. Usually we do something called as complete blood count, CRP. If you're in a high risk category like a diabetic, hypertensive patient, sputum test can be done, chest x-ray might be done. And based on that, if the doctor deems it fit and he thinks it could be a bacterial infection, antibiotics can be added. So this is about the respiratory infections. Now coming to other infections, now only in monsoons we used to see fevers like dengue, malaria, typhoid. We see it somewhere between the monsoons. But now with the rising population and the stagnation of waters and other places, we do see these infections coming year around, not just in the monsoons but also year around. We still tend to see dengue virus, although less in numbers at this seasonal, but then we should consider that. So if your fever is persisting anything more than day 4, high grade fevers, you should approach the doctor and take the right test. They will check if you have any other infections. And also at the same time, like I said, fever is just a symptom. Fever is just a symptom of underlying problem. Now, the doctor will decide whether it is just a viral infection, whether it is a urinary tract infection, whether it is lower respiratory tract infection or any other infections causing the fever. So, any fever ongoing for more than 4 days, like I said, any other symptom which is not getting better, you should see the doctor and appropriate tests will be done. And another important point coming to, with the increased number of COVID cases, so we may have to start repeating the tests. If you are getting fever and cough and throat infections and high grade fevers, definitely testing for corona also has to be done so that we prevent further spread. And if you're sick and if you're not well, it is better to avoid being in crowded places, take adequate hydration and rest at home and recoup. And for elderly population and also for the high risk population, yearly we can give influenza vaccinations. That is an yearly vaccine which can be given, and you should take that if you're at a high risk category. And even for the normal population, influenza vaccine, yearly vaccine is recommended. Anybody who is more than 65 years old, we do recommend other vaccines which can prevent the pneumonia, like pneumococcal vaccine also can be taken. So based on your risk factors and your health condition, your doctor will decide which vaccinations you will need and those vaccinations can be given.